So, Tom, we were talking about this last hour. The bigger problem, maybe in January, February, the computer's fixed, the website's fixed, and people go, what? I don't remember. Whatever. But when people start getting the notices that they're being dropped from their insurance, which the LA Times is reporting, and that the new health care plan costs twice as much as their old health care plan that they had, and they're not able to keep the health care plan that they had, which the president said they could, I think that probably causes the bigger problems.
Well, I think in the long term it causes a huge problem because what we wanted was a system that actually lowered costs, and this is going to raise them. What we did, the idea of trying to fix the health care in this country is not a bad idea. The computer problems will get fixed. It's going to be difficult. No. There weren't computer problems with Medicare Part D. All it was we're going to raise your benefit. Nobody's going to pay any taxes. And by the way, we're going to let private industry figure out how to do that. And they did, and it came in at about half the cost of what everybody estimated what it would do. This one's coming in 3 or 4 times the cost. You're not going to have the same choice. You're not going to have the same physicians. Your access to care when you want it isn't going to be there. And when that all works through the system, and oh, by the way, when young people don't sign up because it's not in their best financial interest to do it, and if they get sick, they get covered anyway, it won't work. And what we've done is lost the very vision of what this country was founded on, how you allocate a scarce resource. You allocate a scarce resource through real competitive markets, not through government-mandated programs. And when you do that, they cost twice as much, they're inefficient, and most often ineffective.
So, David Axelrod, I'm sure you saw the LA Times article yesterday. I'd like you to speak a little bit to that. Also, what do you say to Democratic Senators Jeanne Shaheen and Joe Manchin that the individual mandate should be delayed a year because the site is having so many problems? Is that a possibility?
Well, look, I think that if the site can't be fixed in a reasonable period of time, then you're going to have to look at some sort of delay, and everybody's acknowledged that, including the White House. Whether it's whether you sign on to a year now or not, I think is a very, very big question, and I don't think that's something that one should commit to at this point. Let's see how this works out. In terms of your larger question, though, about the insurance, it's true that some people have been told that their policies were canceled because the health care law sets a floor for coverage. And Joe, I have a very personal view on this. You guys know very well my own experience. I have a child who, when she was 7 months old, started having seizures. I was a young newspaper reporter then, and I got the cheapest policy I could get. I thought that was fine until someone got sick. And what happened was that her prescriptions cost $1,000 a month. I was making very little money. There were other treatments she couldn't that weren't covered, and we almost went broke. And we couldn't switch to another policy because she had a pre-existing condition. This law fixes that. So yes, we have standards now. You get prescription coverage, you get preventive care. That's positive. And the fact is, while we are talking about this, let's recognize the fact that there's this phenomenon that during this whole debate about the website, the healthcare law has become more popular. Look at the NBC News poll, your own poll, and and the healthcare law is polling more positively now than it ever has before. Why? Because people recognize that they're going to be able to get health coverage at an affordable cost.
Well,
and I think that's...
it could be actually the Republicans blew themselves up.
No. I think what the pre-existing conditions and the issues that David brings up,
that was already in the wash, and it was like 32, 33, 34% until this shutdown.
But Joe, I actually think there's more information now about what the Health Care Act does. So I think that has actually boosted the popularity of the program. I wish that everybody would, rather than concentrating on trying to see how we can run this thing down, let's talk about how we can make it work. And if there are problems with it, let's fix it along the way. I think that's how most Americans feel about this program.
I completely
David,
agree.
along those lines, Senator, I want to throw a theory out there. If I was talking to Republicans, I would say, guys, you keep banning this, you're going to hurt yourself. Move on. Next. And I think this is a TBD. I think we've got to wait, 18, 24 months to really see what this thing looks like. And I think there is a real booby trap for Republicans to continue to be the party of no, that something is officially a yes now, and that's what I would be advising Republicans.
Well, I think you make a good point. What the country knows is what we're against, not what we're for. And we ought to be voicing what we're for. But I would just contrast. Can you imagine a system where you didn't spend $700 million to set up a computer program to do this, and you spent $200 and it worked? That's the incompetency of bureaucracies. And so when we're $17 trillion in debt, we have almost $130 trillion in unfunded liabilities. And oh, by the way, Medicare and Social Security are bankrupt. You know, that's what the real numbers say. And we're starting another one program down the road. What we ought to talk about is how does that impact freedom and liberty in the future? And where can we fix what's wrong today?
Yeah.
I agree. Look, they will fix the website. But it's not baseball. You build it, they will come. They're not, because there's not in the economic interest of a young, healthy person to go on this and spend this money. Because as soon as they get sick, they get covered anyway. So it doesn't matter. It doesn't matter if you eliminate the mandate. You can eliminate the mandate. They're still not going to come. What should happen is, if you really want to roll this out, you need to delay it a year. Yeah. So that you can actually, if you really believe, if the progressives really believe the government ought to be running this much of the economy, then at least wait a year on the whole thing and fix it to where it's somewhat effective.
So it plays into the argument, for sure, what's happened with the rollout, Willie, that big government doesn't work well. Bureaucracies get things to be clunky. Still, what it takes to fix this website will not cost as much as the shutdown and all the tactics that were used to try and ward off this law. And don't you think what would be better is if everyone would work together to make it better, to make the law better, or get rid of it, to go through the process to get rid of it if it's that bad?
Yes. I wonder, David said something earlier which echoed what the president said over the weekend, which is that there are a lot of people, namely Republicans, who are rooting for the failure, who don't want to make it better, who want to get rid of it. So in your critique of it, Senator Coburn, would you want to see this law, the Affordable Care Act, carried out better, or get rid of it and replace it? And if so, how would you bring costs down, if not this way?
Well, first of all, remember, the reason costs aren't driven down in the system we had before is you don't have a real consumer making a real choice, with real transparency in terms of price and quality. Myself and Richard Burr had the Patient's Choice Act, which we never could get a vote on during the whole, which we had exchanges.
No,
we covered pre-existing illnesses.
Really quickly, go through it, but explain why you couldn't get a vote.
Because they didn't want to vote on it, because they were afraid we get more votes than what their bill would.
Wait, I don't understand. Because I've heard some Democrats complaining that Republicans didn't have an alternative. And
because they didn't want to show an alternative.
So you're saying you had an alternative, but Harry Reid wouldn't. This is shocking.
We were never allowed to vote on it.
They wouldn't even. What, are you sure?
Am I sure, Joe?
I'm shocked. Well, why would Harry Reid criticize Republicans for not having an alternative, but then not allow a vote on the floor? That's shocking to me.
Republicans are cats. There's a lot of different ideas out there. But the fact is if you want to fix health care in our country, you have to reconnect payment with purchase, and you have to, the insurance company is the middleman. They need to be out of the decision making. It needs to be back between provider and purchaser. And transparency has to be there. There's a hospital in Oklahoma City. It's really interesting. They advertise it's a surgical hospital, advertise all their prices online, what their outcomes are, what they're in fact. They have people coming from all over the country because they're about half the price. Markets, and these people don't have insurance, so they're paying for it, but they're buying it at half the price.
David, it sounded like you wanted to respond.
Well, I did, and I
do you still want to respond?
I have a lot of well, there's a lot to respond to. So let me roll back to the beginning. I have a lot of respect for Senator Coburn, but first of all, this notion that the website crashed because the government was running it belies the fact that there have been website disasters in private industry as well. So let's
David, none of them spent $800 million building a website.
Let's push that aside. You talk about transparency. This is the first time in history that you can make an apples-to-apples comparison about health care plans, online in front of you.
Except with your old plan, because you're no longer eligible to buy your own plan, which was the #1 promise the president made to the American people.
You cannot
get what you had.
Most people are going to keep their own plan, Senator, and you know that.
That's not true.
There were some plans. The head of Blue Cross in Florida was on television yesterday. He said there's a small number of people in his state who are going to be transferred to plans that have a higher quality, and most of them will be subsidized and will end up paying less for those plans. So let's not play games about it. People are not going to. The majority of people in this country, the vast majority of people in this country, are keeping their plan. People who are uninsured are going to have choices they never had before. And as for government, I mean, and there are private carriers. Their insurance is not going to be with the government. Their insurance is going to be with private carriers. So let's be straight about that. Now, in terms of the government getting involved in health care, nobody is suggesting that we should disband Medicare, although we heard many of the same complaints about Medicare back in the day when Medicare was being debated.
David, let's talk about Medicare for a minute.
Nobody's debating about the veterans program.
Medicare is bankrupt. 20% of everything that's spent in Medicare is defrauded from the government. It's over $80 billion a year is defrauded. How's that running for us? I'm not against Medicare, but how about having it run in a way to where the private insurance's fraud rate is less than 2%. We're 10 times greater because we don't know how to do it, and we don't function effectively when the government does it. There's nothing wrong with the program, but let's do it a different way. And what you're seeing roll out with the Affordable Care Act is the same incompetencies that we see in large bureaucratic institutions. It's not that the ideas are all bad in the Affordable Care Act. It's that we're incompetent to roll it out. And we've proven that today.
In the last several years, we've seen the cost of health care, the growth of health care costs level off after a whole decade of almost double-digit increases. And everyone, including the Congressional Budget Office, has suggested that the Affordable Care Act has had something to do with that.
Okay.
All right. So that's kind of an important
That's not an accurate
fact.
representation of the fact. Matter of fact, most of the business analysis and economic analysis of why it's down is because the economy is flat on its back.
No, that's not. Yes,
that is true.
The
that
recession,
is true. That's why healthcare insurance is not risen.
It continues, Senator, and about a third of it.
Continuing at 1.2% growth.
A third of it was ascribed to the Affordable Care Act because there are practices that have been promoted through the Affordable Care Act: reduction in promotion of healthcare IT, reduction in infection rates in hospitals, reduction in readmissions in hospitals, the promotion of accountable care organizations that charge not fee for service but for keeping people healthy. All of those things are beginning to have an impact. So my suggestion is let's make this work. Let's give people who don't have health care the opportunity to have it. Let's give people who have health care quality health care.
If you would have, go read about the Patient's Choice Act. Senator Burr, myself, and about 20 other Republican senators. Every aspect that you're seeing that's positive in the Affordable Care Act was in that bill, except ours doesn't cost $2.6 trillion. Ours isn't run by the government. Ours is run by the private sector with transparency and mandates that you have to be transparent, that you can actually see what you're getting and what you're paying for. And we actually let people keep what they like rather than making a promise, here's what you can have, and then making sure you can't have that. And that's true across every state in this country.
All right, a great conversation, which we will continue. David Axelrod, thank you very much. Senator Tom Coburn, thank you very much.
Thank you.
Up next,
These guys need a late night talk show.
But that
These guys need a show.
Oh, no, they're great.
These guys need a show.
Absolutely great.
best conversations
So that's why
I've
he
seen
shaved
on
the
the
beard.
issue.
That's why he shaved the beard, because he's a hater.
I'm just starting it back, Joe. It's winter.
Yeah, but I mean, by the time the series is over, he's for the cars.
I'm seeing traces of a goatee here, though.
Well, it's just
Up
gray
next,
hair.
we were doing so well. Former Vice President Dick Cheney is standing by.